Morning, getting some sunshine out there, but still some chilly temperatures to contend with across our area. Grace Lim is breaking down your forecast for the work week ahead here this morning. But first, we want to talk about the state of emergency remaining in effect for Washington after a man died from coronavirus in Kirkland.
Yeah, so there are 6 cases in the state with testing underway. There are fears that number could go up. So joining us now is Dr. Drew Oliveira. He's a senior executive medical director at Regence Blue Shield. Thank you so much for being in this morning to answer some questions.
Certainly.
And Dr. Oliveira, we've been reaching out to folks online to ask them, hey, what are some of your questions? One of our viewers on Twitter wants to know, up until now, what specific places does the public really need to be concerned with going? Are there any?
Right now, there aren't any. The Public Health Department will monitor that and let us know if there's places not to go. Certainly where there's known cases like the Life Center in Kirkland, in that facility, absolutely. But right now, there aren't any. We do want to limit our travel if possible, just in general, and being around large numbers of people in general. So there's recommendations from the workplace to, if you can work at home, that's great. That will limit your exposure to other people.
So is that even if you don't have any signs or symptoms, working from home might be a good option if you're allowed?
Yes, absolutely.
Okay, now I do want to ask about this really quickly because the Sounders game is this afternoon. 50,000 people are expected to be at CenturyLink. You were just saying avoid large crowds. The Washington State Department of Health yesterday saying the concern is growing here as time moves forward and with this death here in our state that they may cancel big events down the road. That's not the case yet, though. So should people be going to these games and these big events right now, or is there concern?
I think what we do is we follow the lead of our health departments, and they will monitor the situation in terms of, what's the potential risk. Right now, the potential risk is still low, but each health department has the jurisdiction to limit attendance at events like that or schools and otherwise.
Okay. And as we were mentioning, there's a lot of false information online, of course, and one of those, something that people are saying online, asking about skin rashes, is that one of the symptoms connected to coronavirus?
That is not one of the symptoms. Okay. Coronavirus is a respiratory virus, so things like stuffy nose, watery eyes, cough, shortness of breath, fever, those are pretty classic symptoms. Now, they sound also like the flu and other normal respiratory issues.
Okay, so Brianna on Facebook, she says that she works face-to-face with the public. She wants to know what are the best ways to avoid getting sick.
If she's face-to-face with others, the most important things are personal hygiene. So wash your hands, soap and water, 20 seconds at a minimum. Wipe down areas where that may be contaminated. If you have to work with the public, try to be at least 6 feet away from the other person to prevent any of that transmission of aerosolized droplets.
Okay.
And so anything else out there that you think it's critical for our viewers to know when it comes to coronavirus this morning?
I would say that you have to worry about sort of fake things, as you mentioned earlier. There's no known treatment right now. It's supportive treatment. If you feel like you're getting symptoms or have been exposed, talk to your provider. Don't necessarily go into the office. You want to talk to them either by phone, telemedicine, or otherwise. They can do a review, make sure that you're safe, and then start to monitor you if appropriate.
Got it.
Okay, so there's also a lot of information about face masks and the Surgeon General coming out saying, do not buy masks anymore. Stop buying masks. So this is the N95 mask. This is the one that some healthcare providers are saying does in fact work, but there are some issues with this one. This one is garbage. We can't use that at all, right, Dr. Oliveira? That one isn't going to do much at all.
Well, the one we just threw away is the problem with that is that it lets air from into the outside. Those are designed to prevent the wearer from transmitting to other people, so large droplets.
Okay. This one is the N95. Talk to me about this one.
So these masks need to be fitted appropriately for you. Someone with a beard like myself would probably have to shave to have it fit appropriately. They are disposable, so they don't last weeks at a time, so you'll have to have new ones all the time. They are becoming in somewhat limited supply, so we want to make sure that the folks taking care of people have these and have access to them rather than the general public. And at this point, I think that's the most appropriate way to.
Okay,
use
so
this.
so we don't want people to buy the masks right now. They're kind of reserved for healthcare providers are really having direct contact and they don't have an option to be 6 feet away from these people.
Right. If you had someone in your home that you were caring for, probably a good idea, but you're still going to need to be in quarantine yourself.
Okay, thank you so much, Dr. Oliveira, for being here and for helping us answer some of our viewer questions and making sure that we have the latest on coronavirus. We appreciate your time.
Of course.
Thank you.
Thank you. All right, let's get a check on your forecast now. Grace Lim is here with those details. Hey, Grace.
Yeah, it's the 1st of March.